Heart disease, everything you need to know. Many forms of heart disease. Many heart health conditions fall under the cover term of heart disease. Heart disease is a broad term that covers a variety of diseases and disorders. Various heart conditions include 1. Arrhythmia. An atypical heartbeat is referred to as an arrhythmia. 2. Atherosclerosis. The arteries stiffen due to atherosclerosis. 3. Cardiomyopathy. The heart's muscles become stiff or weak as a result of this illness. 4. Inherited cardiac problems. Heart abnormalities that exist from birth are referred to as congenital heart defects. 5. Cardiovascular disease. Cholesterol accumulation in the arteries of the heart is what leads to CAD. It is also known as ischemic heart disease. 6. Heart ailments. Bacteria, viruses, or parasites may be the source of heart infections. Heart problems that primarily impact the blood arteries are referred to as cardiovascular diseases. Heart disease signs and symptoms. There are numerous symptoms that can be brought on by various forms of heart disease. 1. Arrhythmias. Abnormal cardiac beats are known as arrhythmias. The type of arrhythmia you have, either too rapid or too slow heartbeats, may affect the symptoms you feel. Arrhythmia signs and symptoms include lightheadedness, fluttering heart or racing heartbeat, slow pulse, fainting spells, dizziness, chest pain. 2. Atherosclerosis. Your extremities receive less blood due to atherosclerosis. Atherosclerosis symptoms include shortness of breath, chest discomfort, and coldness, especially in the limbs, numbness, especially in the limbs, unusual or unexplained pain, weakness in your legs and arms. 3. Inherited cardiac conditions. Heart issues known as congenital heart abnormalities arise when a fetus is developing. Some heart conditions go undiagnosed. When they produce symptoms, other things like blue-tinged skin, swelling of the extremities, shortness of breath or difficulty breathing, fatigue and low energy, irregular heart rhythm. 4. Cardiovascular disease (CAD). Plaque accumulation in the arteries that provide oxygen-rich blood to the heart and lungs is known as CAD. Among the signs of CAD are chest pain or discomfort, a feeling of pressure or squeezing in the chest, shortness of breath, nausea, feelings of indigestion or gas. 5. Cardiomyopathy. The condition known as cardiomyopathy causes the heart's muscles to enlarge and become rigid, thick, or weak. The following are signs of this condition: fatigue signs, bloating signs, swollen legs, especially ankles and feet, shortness of breath, pounding or rapid pulse. 6. Heart maladies. Endocarditis and myocarditis are two illnesses that may be referred to as heart infections. Heart infection signs and symptoms include chest pain, chest congestion or coughing, fever signs, chill signs, skin rash. The signs of female heart disease. In particular, when it comes to CAD and other cardiovascular disorders, women frequently exhibit distinct heart disease indications and symptoms than do men. In fact, a 2003 study examined the signs and symptoms of heart attacks that were most frequently encountered by women. Top symptoms didn't include classic heart attack signs like tingling and chest pain. Women were more likely than males to report experiencing anxiety, sleep difficulties, and unexpected or unexplained exhaustion, according to the study. In addition, 80% of the study's female participants said they had been experiencing similar signs and symptoms for at least a month before to their heart attack. Common heart disease symptoms in women include dizziness, paleness, shortness of breath or shallow breathing, lightheadedness, fainting or passing out, anxiety, nausea, vomiting, jaw pain, neck pain, back pain, indigestion or gas-like pain in the chest and stomach, cold sweats. Sometimes the signs of women's heart disease are mistaken for those of other conditions like depression, menopause, and anxiety. Heart disease causes. Heart disease is a group of ailments that affect the cardiovascular system. Every type of cardiac disease is brought on by a specific set of factors. Plaque accumulation in the arteries leads to atherosclerosis and CAD. Below are descriptions of more heart disease causes. 1. Arrhythmia causes. Causes of an abnormal heart rhythm include diabetes. CAD causes heart defects, including congenital heart defects, medications, supplements, and herbal remedies. High blood pressure, hypertension, excessive alcohol or caffeine use, substance use disorders, stress and anxiety, existing heart damage or disease. 2. Causes of congenital heart defects. While a baby is still growing within the womb, this heart condition develops. Some heart conditions may be significant and require prompt diagnosis and treatment. Some may also go years without being diagnosed. As you get older, your heart structure may also change. This could result in a cardiac defect that could cause consequences and issues. Causes of cardiomyopathy. There are various varieties of cardiomyopathy. Each type is the outcome of a distinct circumstance. Cardiomyopathy with dilation. This most prevalent form of cardiomyopathy, which results in a weak heart, is unknown in its origin. It might be the result of past cardiac damage, such as that brought on by medicines, infections, or heart attacks. Additionally, it might be a hereditary disorder or the outcome of uncontrolled blood pressure. Heart muscle hypertrophy. The heart muscle thickens as a result of this type of heart disease. Typically, it is hereditary. Cardiomyopathy with restriction. The cause of this particular form of cardiomyopathy, which causes hard heart walls, is frequently unknown. Scar tissue accumulation and an aberrant protein buildup known as amyloidosis are two potential causes. Causes of heart infections. The most frequent causes of cardiac infections include bacteria, parasites, and viruses. If untreated internal infections are not under control, the heart may also suffer. Some heart disease risk factors. Heart disease has numerous risk factors. Some are under our control, while others are not. According to the CDC, about 47% of Americans have at least one heart disease risk factor. These risk elements include, among others, high blood pressure, high cholesterol and low levels of high-density lipoprotein HDL, the good cholesterol, smoking, obesity, physical inactivity. One risk factor that is under your control is smoking. According to the National Institute of Diabetes and Digestive and Kidney Diseases, people who smoke have a twofold increased chance of having heart disease (NID). Because high blood glucose levels raise the risk of, people with diabetes may also have a higher risk of developing heart disease, angina, heart attack, stroke, CAD disease. Controlling your blood glucose is crucial if you have diabetes if you want to reduce your risk of heart disease. According to the American Heart Association (AHA), patients with high blood pressure and diabetes have a twofold increased risk of developing cardiovascular disease. Risk factors outside of your control. Other risk factors for heart disease include family history, ethnicity, sex factors, age factors. Even while you can't manage these risk factors, you might be able to keep an eye on how they're affecting you. A family history of CAD is particularly alarming, according to the Mayo Clinic, if it involves any of the following: a male relative who is younger than 55, such as a brother or father; a female relative who is younger than 65, like a mother or sister. The risk is higher for non-Hispanic whites, non-Hispanic blacks, and those with Asian or Pacific Island ancestry than for Native Alaskans or Native Americans. Men are also more likely than women to have heart disease. In actuality, according to the CDC, between 70 and 89% of all cardiac incidents in the U.S. involve men. Finally, being older can make you more susceptible to heart disease. Men and women both have a similar chance of developing CAD from 20 to 59. The percentage of affected men, however, increases to between 19.9 and 32.2% beyond age 60. Only 9.7 to 18.8% of women in that age range are impacted. Bodily examinations and blood tests. Your doctor will do a physical examination and ask you about your recent symptoms as the first step. They will then inquire about your personal and family medical histories. Some heart conditions may be influenced by genetics. Inform your doctor if you have a close relative who suffers from heart disease. It is common to request blood tests. This is so that they can assist your doctor in checking your cholesterol levels and looking for inflammation-related symptoms. 1. Non-invasive procedures. The diagnosis of cardiac disease can be made using a variety of non-invasive diagnostics. Electrocardiogram ECG or EKG. This examination can track the electrical activity of your heart and assist your doctor in identifying any anomalies. Echocardiogram. Your doctor will receive a detailed image of the structure of your heart through this ultrasound test. Examination test for stress. This examination is carried out as you exercise vigorously, such as by walking, running, or riding a stationary bike. Your doctor can observe how your heart beats in response to variations in physical exertion during the test. The carotid ultrasound. Your doctor may request this ultrasound exam to obtain a thorough image of your carotid arteries. Holter monitor. You could be required to wear this heart rate monitor for 24 to 48 hours by your doctor. They can see more of your heart's activity this way. Table tilt test. Your doctor could recommend this test if you've recently felt dizzy or faint upon standing up or sitting down. Your heart rate, blood pressure, and oxygen levels are measured while you are fastened to a table and steadily lifted or lowered. ACT scan. Your doctor will receive a highly detailed X-ray image of your heart from this imaging examination. Cardiac MRI. A heart MRI can produce a highly accurate image of your heart and blood vessels, much like a CT scan does. 2. Invasive tests. If a physical examination, blood tests, and non-invasive testing don't provide a clear answer, your doctor might wish to perform an internal examination to identify the source of any uncommon symptoms. Invasive tests could consist of cardiac catheterization and coronary angiography. Through the groin and arteries, your doctor might put a catheter into your heart. They can do tests on the heart and blood arteries with the catheter's assistance. A coronary angiography can be done by your doctor once this catheter is in your heart. A dye is injected into the fragile arteries and capillaries around the heart during a coronary angiography. A very precise X-ray image is produced with the aid of the dye. Electrophysiology study. A catheter may be used by your doctor to insert electrodes into your heart during this test. Your doctor will be able to record the heart's response after placing the electrodes and sending electric pulses through them.